really is my honor and pleasure to be talking with Ninie Wang today. I've known Ninie for many years. She is the founder and CEO of Pine Tree Care Group, which was founded in 2004, a Fortune 20 startup with the most social impact in China in 2021, focusing on business model innovation, professional service, and talent development in providing restorative integrated care services for an aging population since 2004. Standing committee member of the China Association of Gerontology and Geriatrics, Ninie is actively involved in domestic and international initiatives promoting healthy aging related research, practice, and policy. She led the implementation pilot of WHO's ICOPE, or Integrated Care for Older People in China in 2020-2021, and is preparing a multi-center ICOPE China pilot in 22 to 24. Ninie joined Johns Hopkins University, PhD candidate, Instead MBA, and she's a member of the WHO Clinical Consortium on Healthy Aging, WEF Young Global Leaders Forum in 2013 to 2018, member of the Global Future Council in Health and Healthcare in China. And in 2022, Ninie was named one of the UN Healthy Aging 50. So it really is an honor and a pleasure to be talking with you today, Ninie. Ninie, you're based in Beijing. You started your organization in 2004, which you were probably 10 or 11 when you started that organization, because you look too young to be running an organization for nearly 20 years. So can you tell us a little bit about your background, what led you to develop Pine Tree, and where it's going in the future?
Sure, thank you. Hello, Greg, and thanks a lot for IFA for inviting me to this Global Cafe, and greetings to all of the participants and audience of this Global Cafe. So as Greg mentioned, I founded Pine Tree Care Group in 2004, but my worries about the aging population started around year 2000, where after a couple of years after I graduated from university, and when I was working in the telecom industry, I was among the first, I worked with Motorola back then, and I was among the first to study the development of mobile internet, and was like writing science fiction about how mobile internet would change our lives in 20 years, which is where we are now. And back then it was really fun, but soon I read more and more about how our society was going to face the mega trend of population aging. And I looked around at my friends who were retired and who were entering into their senior years. And I saw the challenges they were facing, both themselves and also their family members. And I thought, this is not how it should be. If all of us or most of us can expect to live so much longer than our previous generations, we definitely want a better way, a better life when we live longer. It was very simple thoughts. And then I looked around, I read more. The more I digged into this, the more I felt the kind of calling. It was like, this has to be changed, and not by one person or one organization, but by many people really awakening to the challenge. So in 2001, when I realized this was really going to be a fast developing challenge to the society, I decided that this was going to be my long-term pursuit. And to do that, I actually weighed a few different options. I thought about entering an NGO like IFA and other organizations within China. And I also thought about maybe becoming a civil servant to look at the policy making of relevant topics. But eventually I decided that for me, maybe the best way for me to make a difference would be to find a business model that could sustainably and at scale try to solve some of the main challenges. So I actually, end of 2002, I went to the business school INSEAD in Fontainebleau, France, to develop this idea. The very simple idea was that how we could improve the way people age and change how people think about aging. And back then, I really didn't know that much, but I knew what was the situation back then was not the way to go. So I went to business school and I took all the courses I could find about entrepreneurship, about social impact. And then I created this business plan. And by the end of 2003, when I graduated from INSEAD and came back to China, I was ready to start something. And this was how it started. But back then, I really had very little idea about all the gerontological and geriatrics topic behind this. And that's how it just, the 18, 19 years really just flew by, as I had so much to learn about and so much to really to do trials and errors. And here we are.
Yeah, well, look, it's been an interesting journey for you, I'm sure, as it has been for many people in the field of aging. China's a big country with a huge population. I think some of the population projections would indicate that there's 400 million people over the age of 65 in the short future, which is more than the entire North America. Certainly brings some challenges. I'm interested to know, so you came into this in 2004, you've worked through to 2023. What has been the significant changes that you've seen? And one comment that I do want to make, I'm glad that you didn't go into government, because I think your impact has been much more on policy, working as Pine Tree rather than working in government. So tell us a little bit about where things have moved from to where they are now, and what you think is the future in terms of aging as we move forward.
Sure. I really love your comment. I think I also felt the same, because in China, actually, one thing that hasn't changed much was that there are so many different ministries, different government agencies, and different stakeholders involved in making policies and practicing different services or building systems to support the aging population. And this, and in many ways, the different organizations work in silos. And it's very difficult to, from within each organization, to coordinate with each other really as peers. It was very funny back 18 years ago when I first entered this field as one of the first few entrepreneurs. People really didn't know what we were trying to do. Caring for the aging or aged population was seen as either a philanthropic initiative or a responsibility by the government or the state-owned organizations. So they were like, what are you trying to do here? This is certainly not a business. Who should be your ministry? Like, who should really monitor you or guide you? There was no answer. So I had to actually go talk to different organizations. I had to talk to Ministry of Civil Affairs, who have always been in charge of the social welfare of the different population groups, including the elderly. I had to also work with the Ministry of Health, and now later on they changed names, and now it's called National Health Commission, because there are so many resources that our aging population needed that are around the health and medical care network. I also had to talk to the administration in charge of Social Security, social insurance. And there's also the State Council, there's the National Commission, National Development and Reform Commission, NDRC. All the different stakeholders had their perspective and had their say. So over the years, what I've observed and also in some ways participated in was the development of improving dialogues among the different stakeholders. There was the development of a National Committee on Aging that was meant to coordinate among the different policymakers. But in some ways, the fragmentation of decision-making is still there.
Yes.
But there was a major change that came in 2008, because there was the understanding that we couldn't just continue building more nursing homes. In the past, attention was given to the building more beds to take care of the elderly that needed institutional care. But then in 2008, the government decided that caring for elderly at home or in a community was probably the direction to explore. And then in 2013, there was a national directive on developing or accelerating the development of services, including care services for the aging population. And then in 2015, there was the promotion of integrated care. So for the first time, it was a national policy to integrate medical, like health and social care for the elderly. As of today, a lot of discussions really have now gone from looking at the nursing home beds to more person-centered. So now people are saying we have like close to 300 million people over the age of 60. And about 240 over 65 today. And this is the population over a certain age. It's not just one population. These are like 300 million individuals with their different needs and their personal environment and their personal goals in life. And there are more and more people from all these different stakeholders discussing how we can build and improve a system that can support these individuals to improve their health and enable them to do what matters to them. And that was, the change really happened very gradually. But for China, it was still very slowly. Because people really feel the pressure. And before COVID-19, I would say more and increasing attention was given to this discussion and to this direction. Although the COVID situation in many ways changed how people do things, and China put a lot of emphasis on keeping the most fragile population, especially the elderly in nursing homes, well protected.
Yes.
So in some places, progress of the care integration sort of paused or slowed down, but in many other places, it was even more sense of urgency to accelerate this.
Yeah.
Yeah, so that's the major background.
Well, thanks, Ninie. Now, if people have got questions that come to mind for Ninie, please post them in the chat, and I will ask Ninie some of those questions and call on people to pose those questions to Ninie as we go. Ninie, how did you get involved with ICOPE, and what's the impact ICOPE is having in China now?
That's actually worth another 3 days of coffee together. I remember actually it was on one of the IFA annual meetings that I saw some of the presentations, and people in other developed countries talked about how they were providing more integrated and also restorative types of care. And I thought that that's actually what China needed. The country will not afford to look after passively 100 million people who are care dependent. If we continue as it was back then, we would just be collecting a fast increasing number of elderly that have to depend on other people's care. But that care doesn't improve their own quality of life and doesn't make people happy. And that's going to be a burden that neither the families nor the society could afford. So I actually started there. And when WHO started the clinical consortium on healthy aging, it was around also the preparation of the World Report on Aging and Health.
Mm-hmm.
And then I heard a task force was drafting the ICOPE guidelines. So I sort of volunteered myself. I said that if there's certain way I could contribute to this work, or somehow bring this to China, because I feel the need, just feel free to use me. So I got into the discussion, and I think in a way I also showed how in China, because of the vast number of people we had to care for, how we used the ICT systems to build all the different care pathways into the system, and to use that to enable the frontline care workers to develop person-centered care plans, and then use the information system to monitor the outcomes, how it's really making improvements or any changes to the things that matter to the quality of life and to the self-rated health, etc. And when I introduced this, and when I talked about having person-centered goal setting, it seemed also very interesting to the clinical consortium. And then they actually invited me to write about how we do this part in China. So I got really deeply involved in the initial drafting of ICOPE. And I understood that all the different elements that were included in the ICOPE guidelines and then the care pathways and the implementation framework really had to be then adapted to local conditions. So that's how I first got involved. So when the different documents were released by World Health Organization, I was also among the first to check whether they had a Chinese version. And when the answer was not yet, I would volunteer to work with colleagues from other like top universities in China to make the proper translation and then start publicizing about this, the guidelines, the pathways, and make more people realize there's evidence-based tool that we could now use to think about the implementation of an integrated care model, which was something people all knew was good, but people always wondered whether in a country that's so resource scarce in terms of healthcare and social care, whether it's the right model. So I was convinced that this was the best way to respect each individual's priorities and needs, and the best way to coordinate the different providers, different stakeholders in developing and improving our care, our not only care, but health systems for this population.
Thanks, Ninie. When we started chatting initially, you talked about a new report which was released by a joint report with Lancet last week around healthy aging in China. Can you tell us a little bit about that and where you see ICOPE going as it progresses in China?
Sure. Yeah, just as of last week, the colleagues and friends at Peking University, led by Professor Yaohui Zhao, released the latest report, which was done together with the Lancet on China's development and current status about around healthy aging. And that report, I'm sure you can find it easily on the Lancet. And it really did comprehensive research since I think the project really started in 2018. And then they looked even further at the CHAOS data, the China health, I forgot the whole the name, but CHAOS is one of the largest database that Peking University team have been like collecting for over 10 years about the life and health of the aging population in China. So they have done a lot of research around the data and around also the latest development of policies and different the development of different relevant industries and where people's health status and care dependency has been developing, and how our social security system will also need to evolve around the goal of supporting healthy aging. So it really, the report was, I think, divided into 5 major parts and came to the conclusion that China really is ready and should be moving towards a system that supports the building of a healthy aging society. And that includes policies that need to treat the resources, need to reallocate resources to build a system that really integrate different efforts and integrate the different services that supports healthy aging. And that includes a payment system that also incentivize people to improve the way we provide services, not only care, but all sorts of services that are needed. Yeah. And they also, in that report, they also made the outlook that because today, if we look at the aging population in China, they actually observed a slight decrease in terms of care dependency, which is good because that's the direction we want. But when they share the outlook, they would really like to call for more actions, the building of a continuous national database that emphasizes the improvement of physical and mental capacities of our population, not only the elderly, but also the whole population, taking the life course approach. And they would like to make more conscious choice of services that enhance people's ability to take care of themselves and stay active in the society. So it's a really it's a very fresh and really relevant report for everyone in the world to understand what the situation is and where China is going in terms of also joining the initiative of the Decade of Healthy Aging.
Yeah, okay, so thank you very much. Now, you were nominated as one of the Healthy Aging 50, which is phenomenal, and I know it's absolutely warranted from the work that you've been doing for the last 19 years, so I thank you for that. You mentioned that you told one of your professors that you were named one of the Healthy Aging 50. So what was his comment back, or their comment back to you?
Thank you. Yeah, it was a funny moment because I was humbled because there are so many people in China and so many colleagues and partners who have been doing all the important work, and they have done even a lot more than I did. But getting the nomination was really super encouraging for me. So I shared the news with a few people that I was really close to, including my old teacher. And his reaction was, "But Ninie, you are not 50 yet, are you?" he thought it was for people who are healthy aging and who are at the age of 50. And I thought that was actually a good aspiration. I think we should all, at any age, if we get to 80, 90, 100, 120, that's actually my hope with our work, with our joint work. I hope people at any age can still be happily aging and enjoying the life at that number.
So thank you for that, Ninie. Now, as questions are coming into the chat box, I'll actually pose some of them to you, and I'll ask people to raise them themselves. So please feel free to put questions into the chat box. But I wanted to raise 2 points that came up, and one was from Rosie, who was talking about, is the private sector participating in any way in integrated care systems? And then Dominic Boyd actually asked, can you briefly define the term integrated care in the context of the Chinese culture?
Sure. First question is a definite yes. Well, Pine Tree, for one, is a private organization. And in fact, as we look at both the health and social care sectors in China, the private sector has really developed fast in the past, I would say since 2013, since the national directive to accelerate the development of services for the aging population. And in integrated care, it's true that a lot of resources are still in the hands of government-owned or publicly owned institutions. However, like I said earlier about ministries or other government agencies, as long as they have their own organization to think about first, the integration is not going to be peer-to-peer, because one ministry will always say, let me integrate you into my system. And that goes also to other public organizations. They have their priorities, but private organizations, we actually had the benefit of not owning much of the major resources. So we could actually start really from the person. And when we go to each individual and we do the screening and assessment, and when we understand what their real needs are, we do not have a stand. We cannot say, why don't you just use all our services? Because no private organization can provide everything. So we naturally have to go around and help them coordinate different providers and different organizations and work around the individuals' goals and needs. So private sector actually has I would say, a better position to help integrate the different care and different services. And in terms of, there are many ways to define it. Here we took from the World Health Organization's guideline, and we define it after first setting the goal as to prevent or delay or reduce the care dependency. So if the goal is that, then when we look at each individual, what we are seeing is their current like status, how their different elements of intrinsic capacity is, and where that's going. And when we identify the risks of developing care dependency, then we sort of follow the care pathway to identify the different resources that need to play together and prevent or delay or reduce the risk of care dependency. So that includes health, like both medical care and other public health related services. That includes social care, which in itself is a very broad category of like basic life support, or like family or informal caregiver support. And there are also the linkage to other services like legal advice, like help them access any public or private programs that may help them increase their financial health. There are all these different elements that are mentioned if we look at the ICOPE guidelines that go basically from the different intrinsic capacity elements to the ways to help deal with issues around that intrinsic capacity. which actually it's hard to put a very clear, to draw a clear line between the different services. But as long as we always look at the person in a holistic way and understand their own priorities, and do not exclude any possibility of helping them deal with the challenges or the risks, then I think all those different services or supports should be included in the integrated care model.
Okay, thank you for that, Ninie. A couple of questions which I'll Shmuel is always participating, and thank you, Shmuel. He's asked how integrated care can improve support, particularly in poor and low socioeconomic communities. And then one of our participants, Tom McCormick, has talked about left behind seniors, particularly in rural areas. And I know ICOPE has very much focused on urban areas in China, but the impact on rural areas and how can it support rural areas, and particularly Tom McCormick has talked about some work from Li Yuan, lecturer at Wuhan University, talking about older people not being able to access services and choosing death over health. So can you make any comments about those, about the rural areas and the impact?
Sure. The first phase of ICOPE pilot in China took place in Chaoyang district of Beijing, which is the largest district in Beijing. And even back then, it was not entirely urban, because this is a big district that also has suburban areas and had also villages that participated in the ready phase pilot. And going forward, as we are preparing for the next phase of a multi-center pilot across China, we are actually including quite a number of much less developed areas and also quite rural parts of China. The reason is exactly that. We believe that integrated care really should contribute to the equity of people's access to care. And in a sense, if we go back and look at the goal of integrated care, as we mentioned, which is to prevent, delay, or reduce care dependency, I think that actually gives us more chance to move on together with the traditionally left behind areas or population. Because if we just leave them as it is and wait for care dependency to happen, given the lack of resources and the long distance between where they are and where more developed areas with better healthcare and nursing care resources are, then there's no way to really bring them up to speed. I think the way we are offering integrated care with the ICOPE pilot is, first, we would identify the nearest local organizations that are providing health or social care in their region, in their area. And we then work together with them. We empower them with the ICOPE system, like the ICT system I mentioned, so that the even less experienced care workers could follow the care pathway, could do an assessment, and the system will guide them to develop a care plan that looks at how to address the different like intrinsic capacity declines or functional issues, and then give them very practical not only advice, but really handbook about how to help the local population deal with those issues. And it's not about sending them to big hospitals when they are ill, and it's not about offering like luxurious care services. It's about how to deliver care using the locally available resources.
Yeah.
If it's about just training their neighbors to give them daily or like every other day visit, if it's about teaching their children to then teach them how to do certain exercise, and if it's about using other resources in big cities to give them access to the medications they needed locally. It's all about empowering their nearest available personnel and mobilize the other social support network. And this way, it really doesn't matter if they already are living next to a big service organization or big hospital. Wherever they are, they get to be assessed, and they get to have a care plan that's following the same care pathways. The difference is that they will not be asked to go for services that do not exist locally. They will, the care pathways will take into consideration what can be done and how their local resources can get supported. If they don't have certain things locally, they can have their, back end to give them access.
All right, thanks, Ninie. Look, I want to give people the opportunity to raise a couple of questions, and I'll call on Erica Da, who has raised a question for you. And Erica, if you could pose that question, then following Erica, if Kathy Pakar-Fuller could raise the question that she had. Erica, are you there? And welcome.
Thank you, Greg. And yeah, thank you, Ninie. This is very insightful. I had a question on ICTs, and while I was writing the question, you were talking about ICTs. My question to you is, given how diverse the system is in China with the local provinces, and you also talk about the various ministries, who is responsible for providing, because you talk about ICTs in the implementation and the monitoring of the care management system. So who is providing the ICTs for older persons? Who's training them? And also, how do you address the issue of privacy when we're talking about technology to protect the rights of older persons? So just raising that. Thank you. And thank you, Greg, for the opportunity.
Well, thanks, Erica. That actually gives me an opportunity to explain what we are doing with ICT. At the moment, given the situation of the really diverse level of development across China, we are using ICT not directly to serve the seniors, but to empower what we call the integrated care managers, which would be the people locally who will be the frontline care providers to them. For seniors who do have a lot of digital literacy and are actively using ICT, some of their services could include direct like online access to video-based therapies or telecare sessions. But for those who do not, because we still have the digital divide here, and people are working to try and narrow that. For those people, ICT really is to enable the local team of providers to overcome their lack of experience or knowledge of developing integrated care plan, or their lack of access to the multidisciplinary teams in large cities that could help them solve some of the more complex issues. So we focus more on using ICT and the systems to empower the service provisioning rather than the direct service. But going forward, and the question of who, we actually, well, Pine Tree, because this was really, it was, for us, it's so not a business initiative. It was really what we believe should be the most important project that we help implement. So we actually developed the ICT system and all the algorithms following the pathways behind it, and we offered it to the National Health Commission, to our Ministry of Civil Affairs, and to all the partner organizations from different industries, different disciplines to use this system. And in terms of the personal data that we do gather when we do the screening and the assessment, they are locally stored, following the. There is, of course, it's a pilot for now. There is always the form of consent, and the people's personal information is only in the hands of the local providers. And centrally, there are different layers of authentication, so that most of the support team or like different ministries, they see aggregated and desensitized data.
Thank you for that, Erica, and thank you, Ninie. Kathy, are you there? And if we can try and keep the responses very short, because I know we're running out of time. But Kathy, do you want to raise your question?
Okay, I guess I was, I'm fascinated by the actual integration. So for the experts who may contribute regarding how to address different capacities, people traditionally work in silos. So do they actually cooperate? I think what I'm understanding is there's a manager who points people in different directions. So that at least helps to get all the pieces together under the care planner and the care manager. But are the disciplines who are contributing expertise working differently, or are they still just working out there in their silos? So I'm curious, how do we get to an interprofessional team that actually works as a team?
Thanks for that question, Kathy. Ninie.
Yeah, thanks, Kathy. They actually, the integrated care managers do not just point people at different directions. Actually, he or she is responsible of collecting the problems and bringing, if necessary, the experts from different disciplines together to discuss the issues and come up with a consensus on what to do, and then integrate that into the care plan and then help implement it. So for each individual senior person, there is one care plan, and there is this care manager that he or she can always contact. But for the different experts, whenever they are needed in a multidisciplinary case, they are either called on like a call like we do, a virtual meeting to discuss the case, or we use in China we use WeChat, which is a bit like WhatsApp. We create a little group to share the issues and the needs, and then they can take their time to comment. And before we change or update the care plan, we always make sure there is a written summary of their opinions, and each of them will sign off to say, yes, this is what I agreed to, and let's do it. And they will also be interested in following up and see what happens next. So in a way, they do not have to go too much out of their normal way of practice, but this coordinator, this integrated care manager, actually helps make their participation in this kind of case discussion or signing off easier.
Thank you for that, Kathy, and thank you, Ninie. Look, there's certainly there's interest in the work that you're doing and how you're doing it. And I know there's been a couple of comments. Asher has said, Ninie, can you please organise some webinars for care managers if possible? So there's some scope as we move forward for you to actually provide some education and training. And are you involved in education and training around the implementation of ICOPE in China for those outside of China, is my question to you.
Well, thank you. Within China, we're actually offering ongoing training sessions to integrated care managers. And now we have worked with China Association of Gerontology and Geriatrics to make it a national, like, continued medical education program that offers actual CME credits to those who take these courses. Internationally, we have not done that much yet, apart from like Global Café here and opportunities to talk to international colleagues. But that would be a very interesting idea to for us to also organize what we are doing here and in different ways share that with people who are interested.
Well,
and that's also our goal of joining the ICOPE pilot programs, because by doing this in China and in different areas across China, we want to also contribute to the accumulation of knowledge and a confidence that integrated care can be organized in low and middle income places and in places where we all face the inequity of care and people with different needs not being fully respected. So that really would be of interest.
Yeah, so I know there would be lots of interest from people around the world wanting to participate, and I know your focus is very much on China. But this brings me to nearly the close of our session, and I just wanted to, some questions we haven't been able to answer. I'm very sorry. It's been such an enthralling, interesting discussion. Perhaps some of you, if we can bring up the banner, I'll let you all know that the International Federation on Aging 16th Global Conference is going to be held in Bangkok in Thailand, entitled Challenges, Transformation and Change, 27th to the 30th of June. I'm hoping, Ninie, that you will be able to join us in Thailand, and for people to hear about and connect with Ninie, there will be some great opportunities. It's going to be at the Bangkok Marriott Hotel, which is a great location, good facilities, and it's purely going to be an in-person conference. We're not doing a hybrid model this year. So take the opportunity to look at the IFA website, the conference website, which is ifaconf.ngo, and I look forward to seeing you all in Bangkok. Now, as for next week, We do have a speaker for next week, and I would like to mention that it's going to be Mr. Darryl Barrett, and he's the acting technical lead with WHO in the Western Pacific. And he's going to be talking with us about health equity, disability, and older adults. So I'm looking forward to that particular session. Ninie, you've enthralled us today. You've demonstrated a passion and a commitment and an ideology to actually support and help influence policy and shape aging in China. What are some of the leaving thoughts that you would have for us here at the Global Cafe today in terms of what are the key messages for us to take away? So I thank you.
Thanks, Greg. And you also made a very good temptation for all of us to go and meet in Bangkok next year. And I definitely hope
you can go
this
through all of
will,
these during
happen.
while you're in there and pick the 6 you want.
Please mute yourself, whoever that was. Thank you. Go on. Yeah, go on. Ninie.
Okay. Yeah, thank you. So I think, yeah, really, this was a super interesting discussion for me as well to really reflect on why we did the ICOPE pilot and where it is in terms of our path to realize the healthy aging goals. I think really you need to look at integrated care from a distance. It's not just about care per se. It's actually, it starts from the ideology, the dream of every one of us being able to live much longer, and we want to live in good health and live in the status that enable us to continue being who we are and doing what we want, what matters to us. So from that goal, we really still can keep looking at the evidence around what works best. Yes, so far our research and our practice has said to us integrated care. And I believe that's actually an ocean of knowledge and further quest that we need to continue to understand and to practice. But that if one day we realize that's perhaps not the best answer, or if we need to make a further iteration to that, maybe it's not going to be called integrated care, but as long as we have the goal in mind, we can make upgrades and changes to the way we develop services, the way we provide care, the way we support our people, but that the direction will not change. But along the way, the model of care or the research, the work we do, they can all evolve, and we may find different challenges in our local situation, local circumstances. But again, I'm glad there are platforms like the IFA Global Café where we get to hear what each other is doing and ask questions to each other. And this is, I guess, this is the best way to find the next answer.
Thank you, Ninie. Look, you're an inspiration to us all, and I can, just from talking with you today, I know why you are one of the Healthy Aging 50. So I want to thank you for the work that you do. I really have enjoyed our discussion today. I look forward to seeing you in Bangkok in June, and I'm sure all of us here will join me in thanking Ninie. So thank you very much. It's been a great session, and I look forward to seeing you next time. So goodbye, farewell, and a particular thanks to my comms team who's really pulled this together. So thank you, Bruna, Luana, and Jasmine. Thank you. Bye now.